education, getting more public awareness of how light therapy works and how it can be used in the benefits of people's homes. And I think this one might have even been clinical. So how practitioners and therapists, whether they're alternative or medical, physiotherapists, you name it, are able to use light therapy and enhance their own therapeutic modalities.
Well, that's wonderful. I know I've met an acupuncturist in Portland that's recently that's beginning to implement the light therapy with acupuncture. So I'm excited to see how that goes going forward. So there's another question I wanted to ask you.
Sure.
You've done wonders for many people by helping them access the hyperbaric oxygen as well as the light therapy. And I was told that you had an experience of your own where you needed some healing. So are you willing to tell us that healing story of your own?
Yes. So I guess this will be on the internet. I, about 3 months ago, fell about 20 feet off of a false ceiling and ended up fracturing 4 vertebrae. I had an L2 burst and had to go in for emergency surgery along with a bleeding head from a major concussion. But an injury happened at 3 o'clock in the afternoon, and I had to go down to the hospital for an emergency surgery. They sent me to a neurosurgery team that could do a spinal fusion. Turned out to be about a 10-hour operation, and wow, probably the most painful period or point that I could remember. And it was in my head. I need to get into the hyperbaric oxygen chamber. So fortunately, it happened in Vancouver, where I have access to the hyperbaric chamber. I also have an access to the hyperbaric chamber in Victoria, Canada, and in Palm Springs. So I started off in the hyperbaric chamber in Vancouver, and about 5-6 days after the operation, signed myself out and went straight into the hyperbaric, and I just stayed in there for as long as I could. After a while, what do? You sleep. It does get tiring, but I knew that that oxygen was going to be powerful. Actually, my first experience in it was right coming straight from the hospital, and it was a bumpy ride, just general driving. Well, when I went into the chamber and when I went down in pressure, as soon as I put the oxygenation breathing apparatus, it's a hood that delivers oxygen in the facial area. As soon as I put that on, it was like I was in the hospital doing that morphine pump. It was quite astounding how significant, because hyperbaric, one thing is also is a powerful anti-inflammatory. In what it does is it reduces fluid buildup and edema, and especially with a spinal cord injury, one of the sequelae that happen is after pain, injury, inflammation, and that can actually be a detriment to especially the nerves going down. So it was apparent that the oxygenation was a significant part of my recovery, because I felt immediately that reduction in pain. And when I started going back up to regular atmospheric pressure, I could feel the throbbing. So you could from a personal point, you can see that. Now, patients have said it helps with their pain and inflammation, but we didn't have much data on it. There's one study that came out published in the Journal of Pain, and I think that was in 2007, that showed hyperbaric oxygen had a significant effect on it. But that's really as much as I had in there. After that personal experience, yeah, I could say it's a definite benefit for pain, or it can be, not for everyone, but yeah. Now